Hey, it's Dr. Birchler here. One of the questions that often comes up in practice on a day-to-day basis is folks who have children is when should they get their kids checked with chiropractic? I think it's natural that any parent, when they have a child, they want the best for them. And I have 4 children. I want the best for them. I want them to be healthy. I want them to develop normally. I don't want any abnormal things happening to them so they can just have a good life. So how does chiropractic apply to that? Well, one of the ways I'll show you is just in a picture form here, but this chart is a general idea of the development of the spine early in life from birth to about a year old. And when the baby is born, they have what are called the primary curves, basically a C curve. And as they go through developmental stages, their spine is going to change. They start to hold their head up on their own neurologically at around 3 to 4 months and start to get the neuromuscular changes that form the curve in the neck. And of course, they start to sit up, starting to get pressure into the lower back. They start to crawl and start to develop the curve in the lower back somewhere around 8 months or so. And then they go from this big shift from a quadruped to a biped. So they go from crawling on 4 legs to then standing and walking and running on 2. And there's this major change in the lower back curvature once they go upright. So the spine actually has these developmental changes, and we recommend that kids are checked at birth because birth can be traumatic to the body in and of itself, much less with suction, traction, complications, maybe malpositioning where the baby is kind of stuck and getting contracted against the pelvic floor. All those things can be traumatic to the spine and lead to problems in health and development. So we recommend a check at birth. Then we recommend a check roughly at 3 to 4 months as a minimum, just as a developmental check. Then somewhere six to 9 months or so as they start to crawl. And then as they start to pull themselves up and stand and then walk. So roughly 4, 5, 6 checks in that first year based on some of those developmental markers. Then as they learn to walk, at the beginning they haven't mastered that yet, and so they fall many times, literally hundreds of times, as they start to walk. And so they're constantly landing on the tailbone, or sometimes they're running forward and they fall and they have this kind of whiplash type of mini whiplash type thing to the neck when they fall forward. And so that from year 1 to 2, when they first learn to walk to when they really kind of master walking or running without frequent falls, I think is an essential year of development to have frequent chiropractic checks. So I recommend to my patients that they have their kids checked at least every month between year 1 and year 2, just because of that phase of development of walking and running and the many falls that take place there. So for those of you that have young children, that's the general approach here. If you have any questions about your family or kids specifically, certainly ask, and we'll do our best to help you.